Welcome, my name is Peter Strong and I'm a professional psychotherapist based in Boulder, Colorado, and I specialize in mindfulness therapy for the treatment of anxiety and depression and especially for the management of panic attacks. If you'd like to learn how to overcome panic attacks without medication, please go to my website and learn more about the mindfulness therapy approach. This approach is very effective indeed for the treatment of anxiety and for overcoming panic attacks and any other common emotional psychological problems that don't require medical intervention. So the reason why we don't want to use medications for treating panic attacks and also for treating anxiety is because they don't change the underlying psychological cause of your anxiety attacks. They simply mask the symptoms. They may provide some temporary relief from the physical and emotional symptoms of anxiety attacks, but medications do nothing to change the underlying cause of your panic attacks. That underlying cause is primarily psychological in nature. It's the result of a conditioned psychological habit that you have acquired for one reason or another. And that is what we must change if you are to fully recover from panic attacks or anxiety. So during the mindfulness therapy approach, we do this by actually learning how to meditate on your anxiety and on the triggers that cause your panic attacks. The biggest problem that I see is that people fall into reactive habits of avoidance and aversion or self-criticism. These simply take awareness away from the panic attacks and the anxiety beneath them, and that prevents them from healing. You must bring conscious awareness to them. You must learn how to sit with your anxiety without reacting and without becoming overwhelmed by it. This is absolutely vital if you are going to break free from anxiety and panic attacks. Because if you don't, you simply end up feeding the underlying anxiety. You end up re-traumatizing yourself. So the first stage of mindfulness therapy is learning to sit with your anxiety without reacting. And the second stage is exploring the structure of your anxiety. The structure is quite interesting, and most people have never really investigated their anxiety deeply enough to see this structure. But the structure is primarily composed of two factors. The first is the habitual reactive thinking itself, which feeds that anxiety. So thoughts do not cause anxiety or panic attacks, but they do feed that underlying emotion. So learning to see these patterns of reactivity is very important, because when you see them clearly, you can begin to break that habit using various mindfulness methods that I teach. And the second part of the structure of emotion involves looking at the imagery of the emotion. How you see it in the mind is absolutely critical to the emotion itself. So when we say we feel overwhelmed by anxiety, that is a clue right there that the imagery of the anxiety is very large, very close, and at a high level in your psychological field. It's essentially above you. And that's what gives the imagery power to create that particular emotion. So seeing the imagery is very, very helpful indeed, because when you can see the imagery, yet again, you can change that imagery. And when you change the imagery, you change the emotion. So that's one part of mindfulness therapy. The third part of mindfulness therapy for anxiety and panic attacks, and other emotions too, like depression, is learning to form a non-reactive relationship with the emotion and responding to the emotion with compassion. That is, developing a relationship that is interested in helping that underlying emotion heal. So developing a healing relationship with your anxiety is also very, very essential if you are to recover from anxiety or panic attacks. So, if you'd like to learn more about how to overcome panic attacks without medication, or how to treat anxiety without medication, then please go to my website, learn more, and then email me to schedule a therapy session via Skype. Thank you.